Hello everyone, I am Dr. Mohammad Hashim, Consultant Physician, Care Hospital, Malakpet, Hyderabad. Today I will be discussing about hypertension. As we all know, hypertension is a very common disease, and in urban India, 1 in 4 adults are affected with hypertension today in India. So the hypertension is a very causing lots of problem in our health. So what is hypertension, and when we call it hypertension, and when we should start treatment, what are the methods to prevent hypertension, and what are the treatment for the hypertension. I'll be discussing about these points. So hypertension, we call hypertension when someone's blood pressure on is more than 140 by 90 on more than 2 occasions. So we should check the ideally blood pressure at when the patient is sitting calm at ideally at home, or if not at hospital, if patient is calm, and after food we should check, and if it is consistently it is above 140/90, we label as hypertension and can start treatment. So the method, what are the different types of hypertension? So there is primary hypertension and secondary hypertension. Primary hypertension means we also call as essential hypertension. For that, any cause is not found. So most of the patients have essential hypertension. Secondary hypertension is there is a cause for that hypertension, and if we treat that cause, that hypertension can also be treated. So majority of the patient have primary hypertension. Now coming to prevention, how can we prevent or the hypertension? For that, we have to take less salt diet, we have to do more exercises, we have to do meditation, and we should reduce our stress level. And that high fat diet also we should avoid. We should avoid junk foods, fatty foods, all these things. Healthy diet if we take and low salt diet will take, that is the prevention of hypertension. If we have hypertension, that is BP more than 140/90, you should consult your doctor and he will start the medicines. Usually patients, what they do, they'll start the medicines. After their BP gets controlled, they stop the medicines. This should not be done, because once you start the medicine, you should keep checking your blood pressures at least once a week or twice or thrice a month, and you should see that your blood pressure is under control. At home also, you can check BP by automatic machines which are available, and they'll also give a pretty clear near values. So you can check with that, and you should keep your blood pressure under control, and you should regularly check with your doctors to change the medicines if required. And what are the complications that BP hypertension can cause? If your blood pressure is not under control, if it is increased, the risk of cardiac diseases, risk of brain stroke, risk of kidney damage, risk of eye retina damage increases. So you should control your blood pressures with the help of your doctors and with diet control and behavioral therapy. Thank you.